Thank you, Mr Deputy Speaker. The Secretary of State opened his statement with very warm words regarding our key workers, but he will be acutely aware that the longer that the Government refuses to address the fair pay demands of key workers, the more staff morale is depleting and the more people will leave the service, exacerbating the staffing crisis highlighted by the unions as part of their demands. Does the Secretary of State not see that standing here lecturing about safe staffing levels when healthcare workers across the UK are saying staffing levels are unsafe is quite frankly ridiculous, and that the way to ensure staffing at all times is to pay our healthcare workers properly?
Minister.
Mr Speaker, of course we want to see healthcare workers paid, and I meant the words that I used right at the top of this. Members of the House will remember my father was ill during COVID. I experienced the NHS at its best and most heroic whilst they were struggling to serve people under almost unbelievable pandemic circumstances. So I absolutely agree with her about the incredible work they do. There is a pay offer on the table that hasn't been invented by the government. It's come from the independent pay review bodies. The government has accepted in full and in every circumstance of the independent pay review body this year their recommendation. And for those who say that we should ignore the independent pay review bodies, they need to explain why that is, and also where they'll find the money to do that in order for it to be fair to the other taxpayers.
Greenwood.